Hi, my name's Christy. I'm going to be your nurse today. What brings you in for your visit?
Hi, I'm just here for my annual checkup.
Okay, and can you tell me your name and date of birth?
I'm Lily Henderick, and it's 5/22/1994.
Okay, and can you tell me today's date and where we are?
It's November 20th, and we're in Burlington at our Northeastern campus.
Okay, and can you tell me the president?
Trump.
Okay, so I'm going to be conducting your head-to-toe assessment. On a scale of 0 to 10, 0 being none, 10 being the worst, are you in any pain?
No.
Okay. So your skin color looks good. I don't see any cyanosis. Are you having any difficulty swallowing or breathing?
No.
Okay, so everything looks symmetrical. Your skin color looks good for your ethnicity. So do you want to be called Lily or do you prefer a nickname?
Lily's fine.
Okay, so I'm just going to start by looking at your scalp.
Okay.
I don't see any sores, lesions, dryness, lice, anything like that, so that's good. Okay, if you could just, I'm going to push down, if you could shrug your shoulders. Okay, and that's testing the 11th cranial nerve, which is spinal. I'm just going to have you open your mouth, stick your tongue out. Okay, everything looks pink, moist. I don't see any dryness, thrush, lesions, sores, anything like that. Looks like you have good dental hygiene. I don't see any dentures or dental caries. So I'm just going to palpate your ears, your auricle, your tragus, your mastoid process. Everything feels good. I don't feel any tags or skin lesions. So now I'm just going to palpate your lymph nodes. I'm going to assess for any tenderness, swelling, or warmth. So supraclavicular, occipital, posterior cervical, anterior cervical, post-auricle, pre-auricle, parotid, submental, submandibular, retropharyngeal. Okay, everything feels good. I don't feel any swelling. Did that cause you any pain? No? Okay. So I'm going to assess your arms. Do you have any pain? Do you have any numbness or tingling when I do that? Can you feel it?
Yes.
Okay. Can you grasp my hands? Okay, push. Okay. I'm just going to check your pulses. Okay. They are normal bilaterally, normal rate and rhythm. You could just put your hands like that. You have nail polish, so I'm going to look under. Cap refill is less than 2 seconds bilaterally, which is normal. I don't see any bruising. I don't see any edema. Skin seems to be intact, so that's good. Okay, so now I'm going to assess your lung sound. So I'm going to start by palpating your carotid artery. Now I'm going to listen to your carotid artery. If you could just hold your breath for a second for me. Okay, and one more time. Okay, I don't hear anything, which is a normal finding, no bruise or anything like that. So I'm going to listen to your heart sounds now. Okay, starting with aortic, which is second intercostal space, right sternal border. S2 is greater than S1. Pulmonic, second intercostal space, left sternal border. S2 is greater than S1. Erb's point, third intercostal space, left sternal border. S1 is equal to S2. Tricuspid, fourth intercostal space, left sternal border. S1 is greater than S2. And mitral, fifth intercostal space, mid-clavicular line. S1 is greater than S2. I'm just going to palpate your carotid while I auscultate. Okay, I don't sense any pulse deficit, so I'm just going to palpate the apex of your heart. Okay, and it's normal. I don't sense any distension. I don't see you using any accessory muscles to breathe. Are you short of breath at all?
No.
Okay. So I don't see any obvious pulsations or thrills, so that's good. I'm just going to check for murmurs now, so I'm going to use the Balomess stethoscope.
Okay.
Going in that same order. Aortic. Okay, so I'm just going to quickly go check your eyes, because I should have done that above. So I'm just going to have you keep your head and neck straight, and I'm going to move the pen. So just follow the pen with your eyes, don't move your head or neck. Okay, so now I'm just going to shine the light. You can just look straight ahead. Okay, so your pupils went from 3 millimeters to 2 millimeters, which is a normal finding. Your pupils were equal, round, reactive to light, and they accommodated to the light. And I didn't notice any shifting or nystagmus of your eyes when you followed it bilaterally, so that's a good sign. Now I'm just going to check your corneal light reflex, if you can just look at me. Okay, so the light was reflected bilaterally in both pupils, which is a normal finding. Okay, so I'm just going to assess your lung sounds now. There's 6 in the front. You can just take a nice deep breath for me. Okay, so bronchial, expiration is greater than inspiration. Bronchiovesicular, inspiration is equal to expiration. And vesicular, inspiration is greater than expiration. Laterally. Okay, if you could just swing around for me so I can see your back. Okay, there's 8 on the back. Okay, you can just stay right there. I'm going to have you take a nice deep breath. Okay, so I saw bilateral expansion, which is a normal finding. I'm just going to assess your CVA tenderness. If you feel any pain, let me know. No pain? Okay, you can come back around. Okay, so if you can lie down, I'm just going to assess your abdomen. Okay, so have you been having any troubles urinating or passing gas?
No.
Normal bowel movements?
Mm-hmm.
Okay, so I'm going to inspect. I don't see any signs of ascites, infections. I don't see any pulsations or bulging or lesions. So I'm just going to take a listen in all 4 quadrants. Okay, I hear sounds in all 4, which is normal. I'm just going to listen to your arteries now, starting with aortic, renal, iliac, and femoral. Okay, I didn't hear any bruise or anything like that, so that's all good. I'm just going to palpate now. If you feel any pain, let me know. Any pain?
No.
Okay, I don't feel any tenderness. Everything feels normal. Okay, so you can swing around for me. Alright, so now I'm just going to assess your legs for sensation. Can you feel that? Any numbness or tingling?
No.
Okay, you could just push against, push down. Okay, so skin color looks good. I don't see any cyanosis. There's normal hair growth. I'm going to test your cap refill. Normal bilaterally, less than 3 seconds. I don't see any edema on either side. I'm just going to assess your pulses. Dorsalis pedis, which is normal rate and rhythm bilaterally, and posterior tibialis, normal rate and rhythm bilaterally. And I'm just going to check your reflexes. Okay, do you have any questions?
No.
Okay, you're all set.
Thank you.